Hey everyone, thank you very much for joining this live presentation of hashtag Ask the Home Care Expert. We're going to give a couple minutes for people to start logging on and getting on this video, and then we'll get started with some questions that have already started to pop in through the hashtag Ask Home Care Expert. We're looking forward to some great questions out there. Hopefully got some good answers for you, but if you have any questions, again, you can kind of put it in the comments section for us all, and hopefully enjoy it. But we're going to give another minute for everyone to start kind of logging on and hopefully build the excitement of this hashtag Ask the Home Care Expert. All right, so here we go. We already got some people on there, and like I said, the questions have already started lining in. So really super excited about this today. It's our first opportunity to reach out and answer questions that you all have had for the last several months. I've been in the field, work with families and other resources, and some of the questions that have popped up are ones that I see every single day. And what the goal of this is not only to answer your questions, but over time, bring in experts, maybe people from home care, maybe from people from hospice, home health, hospitals, insurance, whatever you need. Hopefully I got the answers for you. So we're actually going to start with the first question. Comes in from Madeline in Centerville. She asks, what is home care? What is the difference between home care and home health, private duty? There's a lot of different terms out there for what home care is. Kind of help explain it. Again, this is a common question we get a lot. So think about it two different ways. We want to think about medical and non-medical. We'll start with the medical, and this is going to be more on the home health, or think of skilled care side. And this is the things that have to do with the medical. So, actually got a great sheet here. And if you want me to send it out to you, just pop in your email or send me a personal message. But basically, it breaks down home health and home care. So home health, again, being the skilled, being the medical, is more of therapy. It's more of administering medications. It's pain management. It's wound care. Things that have to do with actual medications, that's more on the medical side. That's more skilled or home health. The non-medical or private duty or home care is more of the ADLs or activities of daily living. Think of bathing, toileting, dressing, things that you're going to be doing on an every single day basis, personal type of care. Private duty and home care also include companionship. So that might be a sitter service. Someone just to kind of watch out for you and make sure you don't fall. We have a fall prevention program, making sure that you don't get out of areas, make sure you're able to move around. A lot of transportation, taking to doctor's appointments. That would come under the home care side. So again, home health and skilled care is on the medical, and then private duty or home care is on the non-medical side. So Madeline, hopefully that answers your question for you. Let's see, next question. This from Noah and Chantilly. What training is involved for the caregivers? So this is another great question that we get all the time. Families want to know, where are these caregivers coming from? Are they just picked out of the street or picked off of a Craigslist? Well, the great thing is that every company I've ever met with or known across the board have always done a full background check. Now, it varies depending on the company. From the smaller companies might just do a local check, might just do a police check, which is required in the state of Virginia. Some of the larger companies are able to do a full federal background check. And the reason a full federal background check is important is because caregivers, travel from state to state. So you want to make sure that their background is completely clear. We're also looking for sex offender list, any type of issues that it might have come up against the caregiver, stealing, stuff like that. So you want to make sure that the caregivers have gone through a full background check. Also, most companies will personally interview the caregivers, either through Skype or one-on-one, bringing them into the office. So you want to hopefully they've met them a few times. The other thing is that the caregivers, I find two different types of caregivers. Caregivers that have worked for about 2 years, they're just kind of getting into the industry, and then caregivers that have 5 or more years of experience. And the ones that have 5 or more years of experience are the ideal caregivers because they're in the industry, they know what they've been doing, and they want to be in this industry. Sometimes I find that the caregivers that have less than 2 years just trying to get a paycheck or just trying to figure that out, or you might find a benefit of those 2 years looking to get an RN. So some of the under 2 years are quite good. But you want to find out how many years of experience the caregiver has and also what type of experience. A lot of companies offer specialty training in dementia care, Parkinson's, fall prevention. So some of the caregivers have gone through that type of training as well. So that's another kind of different ways to be able to find out. One of the neat things that we see a couple of companies doing, and HomeCare.com has actually started this, is a rating system on the caregivers. So kind of like Yelp or Uber, where at the end of a service, you're actually rating the caregivers. You might be able to see some ratings and reviews and references from the caregivers. So that's another way of being able to double check and make sure the caregiver is actually who they say they are. All right, let's see. Another question. This one's from Doris in Silver Spring. How do I know which company to choose from? This is always a big one. So here in DC, we have the Source Book. I'm sure there's a lot of senior newspapers out there, a lot of different resources. Here in DC, in most major cities, there's anywhere from 500 to 1,000 home care companies in a market. And you'll see the gamut. You'll see, again, the small companies that work, again, in a 20 to 30-mile radius. You might see some franchises. You might see some national ones you've heard on the radio or on the television. So there's a lot of different types of companies. And a lot of companies have their own like little niches. I know some companies that just work with dementia or just work with Parkinson's. So there's a lot of different companies. But how do you choose the right one? Well, the first thing you want to do is go on the company's website, go on their Facebook like you're going on today, and look about the different comments, not what they're posting, but maybe some of the comments that people are leaving. If they've got ratings and reviews. You want to see if they're providing educational information or they're just trying to sell. Next thing you want to do is you want to talk to a home care expert. So call up the company and ask them some questions. If you go to our website, HomeCare.com, we actually have a list of questions that you can ask home care agencies and home care companies. For example, how long they've been around, what type of experience do the caregivers have, what type of training. Some of the questions we've actually answered earlier today. But you also want to find out what type of questions they're asking you. Are they simply asking you a schedule, what you need and where you're at? Or are they taking the time to do a full assessment? Find out what medications you or your family member is on. Find out where you live, what other family members are local and there to support you. Or find out, if you've recently been in a hospital or falls. We learned that a family member had fallen 3 times in the last, I think it was 6 months. That's big information. And if you're not asking the right questions, you're not going to get the right answers. So it's really important to make sure you're asking that the person is interviewing you and getting as much information. If it's a quick 5-second thing that they're saying, hey, our rate is XYZ, then that's probably not a good company. A company that does a full assessment should take about 5 to 10 minutes. I was reading a couple of the comments. 5 to 10 minutes in there is a good assessment. The longer, the better. Again, they're trying to find out as much as they can. And the reason for this is because you want to find out how they're going to pick the right caregiver for you. Some companies, if they have 50 or less caregivers, might just send whatever caregiver is available. They have 100, they've got a little bit more room. The larger the company, the more caregivers they have, the better it is for you. So ask them, how are they going to find the right caregiver for you? It's a really important question because you want to make sure you're matching up, not based off of just needs and a schedule, but you want to find out personality. Will a caregiver be able to be interviewed? So a lot of kind of goes into finding the right company. And I strongly recommend calling around a few different companies to make sure that you're getting the right one. Also, ask your local assisted living, hospice, hospital, or anybody else in the healthcare industry might be able to give you a good recommendation. Let's see. The big one. So the 4th question I got today is money. So everyone always asks, how much does this stuff cost? How much is home care? And is it covered by Medicaid and Medicare? This one was actually from Irv in New York. So thank you, Irv, on this one. This is, again, a really popular question. I'm actually going to show something. So this is Genworth. They're a long-term care insurance company. You can go onto their website, and what they do is they actually break down how much home care will cost, as well as assisted livings and some facilities. It actually breaks down the costs by state. So HomeCare.com is actually, we're all over the East Coast. So Maryland, D.C., Virginia is our strongest. We're also in Pennsylvania, New York, North Carolina, Florida. And even our rates may change based off of where the family is located. But kind of get back to the first part of it as far as how is it paid for? Well, most home care is actually paid privately or private pay out of your pocket. Most companies do accept some long-term care insurances, Genworth being one of them, John Hancock is another one. But as far as Medicaid and Medicare, unfortunately, it's not covered when we're talking about home care. So again, the ADLs, the personal care, the companionship is not covered by Medicare, Medicaid, and most health insurance plans. So if you have the Blue Cross or something like that, again, it's not going to cover private duty personal care. And if you think about it, the reason why is because it's again, non-medical. So the non-medical is basically somebody coming into your house. Again, these people are trained, they're certified nursing assistants or home health aides. But again, they're there and they're providing personal care, bathing, toileting, dressing, companionship. So the insurance companies don't usually cover anything that's not medical. You know, I mentioned the hospice and the home health earlier. A lot of that stuff is covered, again, by Medicaid and Medicare. But as far as our services go and home care services, it's privately paid. Now, your next big question is, okay, how much is it? It can range. I've seen as low as $14, $15, $16 for getting somebody right off of Craigslist to as high as $30 by some of the major companies. You know, our company starts at $21, but again, any company that gives you a rate over the phone or without meeting with you or asking you those questions is not giving you a truthful answer. So make sure that they're asking you the right questions, and they should be able to give you a determination based off exactly what you need. Again, with most things and most health insurance, with most health programs, the more you need, the more it's going to cost. So if we're talking about simple companionship services, a sitter services, which is a lot of times an aide in a hospital, aide in assisted living or rehab, or just sitting there in your home, is going to be a lot less than someone who's in a wheelchair, dementia, Parkinson's, COPD, any of those additional services, or two people. The other thing as far as prices go is a lot of times it's going to be hourly. So how do you break everything up? Most companies have a 3 or 4 hour minimum. So think about that. Some companies may have a day rate or a live-in rate. A live-in is someone that actually lives in the home and works, you know, roughly 12 to 16 hours a day. Now, the new laws that have come in specify that that person's got to be able to sleep for a max of 5 hours uninterrupted, 8 hours total, 5 hours uninterrupted, of time. So those are their hourly rates. Sometimes there's day rates, and again, live-in rates. Again, it all depends on, you know, how much care and need you have. So hopefully that answers your question, Irv. All right, let's see. Any more other questions? Are those only the areas we serve? Andy, no. So HomeCare.com actually covers the entire East Coast, so a lot from New York down to Florida. So I think the number's in there. If it's not, 1-800-967-4284, or the number on the thing you can reach out to if you have any questions. So my question for you, and to leave in the comment box here, question of the day, and again, I want to see these in the comments and for next week's show. Is there an expert or area that you would like to learn more about? You know, I mentioned home care, I mentioned home hospice, home health. I have a lot of resources. And so if you ever need anything, again, personal message me. Again, use the hashtag #HomeCareExpert. I'm happy to answer questions. But if you want to learn a little bit more about hospice, home health, long-term care insurance, I can bring in some great experts to be able to talk to you and answer your questions. So leave a comment below. Let me know which you'd like to learn most about, or any other questions. I can answer it on next Friday's show. So again, hopefully you turn in for that. And again, if you really like this show, you know, please like it here, and for all the people that are on right now, please like it. And those that are watching later. Hopefully you like it. If you really, really like it, I hopefully that you share this with some people and get the word out about HomeCare.com, about the expert here to be able to answer any of the questions regarding home care. So thank you all very much for watching. Look forward to seeing you next Friday at 1 o'clock. You keep asking questions, and I'll keep answering them. Have a great day.